I'm a general cardiologist with a special interest in cardiac arrhythmias. Arrhythmias means heart rhythm disturbance. That's what arrhythmia generally means. And to diagnose arrhythmias, we need to do a study called electrophysiology study. Before that, I want you to understand that our heart is a very fascinating structure. It does have an electrical circuit that is built in. You need some electrical impulses for the heart muscle to contract. The heart generates its own electricity. So this is done by a very specialized process called a conduction system. So the impulses do originate from the upper chambers of the heart called the right atrium, and the impulses then travel to the junction between the atrium and the ventricle, and then they travel along the ventricle through specialized fibers which can conduct electricity. So there could be faults within the electrical conduction system. Either there can be defective conduction, or it can cause some kind of a short circuit that can result in cardiac arrhythmias. Arrhythmias means heart rhythm disturbance. That's what arrhythmias mean. These arrhythmias can be either slow heart rhythm or they can be very, very rapid heart rhythm. If it is a slow heart rhythm, then we need to do what we call a pacemaker. For rapid heart rhythm, we have procedures called cardiac ablations and also implantable electronic devices like defibrillators, etc. Say, for example, if somebody has a very slow heart rhythm, they can present with variety of symptoms like feeling dizzy, feeling lightheaded, they can feel extremely fatigued, they can feel they are going to faint and pass out or actually can pass out. In a situation like that, electrical study of the heart is extremely important, and this is a procedure that I do all the time. This procedure involves going through the groin, placing wires inside the heart, and then recording the electrical activity within the heart. It is like doing an EKG from within the heart, if you will. That's what the EKG does, picking up those electrical signals, and this translates into an EKG when we do that outside. Here we are actually placing the electrodes within the heart, and we have a specialized procedure that we follow to see whether the conduction is proper, improper, defective, or it can lead to abnormal heart rhythm like rapid heart rate called supraventricular tachycardia, etc. If the electrical wiring is not intact, these patients will benefit from implantation of a pacemaker. That's a minor surgical procedure. We place wires inside the heart. What we do is that we go underneath the collarbone, we gain access to one of the veins that drains into the heart, and place wires in the right upper chambers and wire in the right lower chamber, and make a small cut underneath the skin to make a pocket to put the pacemaker battery underneath the skin. This procedure normally takes about 30 to 35 minutes to do it, and in some patients this pacemaker is a backup. It is like an electrical generator. When your power goes out, the electrical generator kicks in and gives you the power. The same thing when the heart doesn't beat on its own, the pacemaker will then put in the beat that is missing. In some people, pacemaker is a life and death situation because they are pacemaker dependent. If the pacemaker doesn't work, then the heart doesn't beat, and you know the end of the story. Most of it is done under what we call conscious sedation. We give them medication to put them to sleep, but the patient can be easily arousable. We call them by name, and we give a lot of local anesthetic agent to numb the skin up so that way they may not experience any pain. Generally, this procedure does not require general anesthesia because we know general anesthesia has its own complications, and on a procedure like this, we do not need general anesthesia. The recovery time is not even 24-48 hours. Most people can go back to doing their normal regular activity within 48 hours or so. Of course, they have to follow some wound care instructions and everything because infection is a major consideration. As long as they follow all these instructions, they are back on track, and then they can lead a healthy, productive, normal life.